some artifact going on, there's some bradycardia, and to help progress this case clinically, they got a core temp of 86.6, so pretty hypothermic. And I want to draw your attention to these weird waves there at the end of the QRS complex. And for those that aren't familiar, most commonly in hypothermia, we get the presence of what's known as a J wave or an Osborne wave. And with these Osborne waves, you can kind of think of them as progressively getting worse as the temperature gets lower and lower. So here's an example of an Osborne wave, just a small blip there with core temps in the low 90s. And then as it progresses, core temps into the low 80s, it starts to become a little bit more pronounced. And then core temps into the 70s, you can actually see that it becomes overly pronounced, even to the point sometimes of being a STEMI mimic. You'll also see a lot of the time with these hypothermic patients shivering, so you'll get a lot of shiver artifact along with the Osborne waves. It is common to see bradycardias, atrial fibrillation as it gets slower and slower, and some of that artifact, and of course the Osborne waves. So it's traditionally thought that Osborne waves or these J waves are seen exclusively in hypothermia, but just remember that's not always the case. A classic example is actually hypercalcemia. So patients that present with serum calcium greater than 11 will often get a very short QT interval, and that T wave will butt up right up against the QRS complex, making it look very similar to Osborne waves. Another common example, you can see here, there's notching here throughout, and this could be easily be mistaken for somebody who has just a slight drop in their core temperature, but this is actually a pericarditis situation. And then finally, another example to be wary of is a Brugada pattern, which is a cause of sudden cardiac death and syncope, and this also looks very similar to these Osborne waves.